Hello and welcome. Today we're taking an architectural tour of one of the most brilliant structures in the known universe, the human heart. It's an absolute masterwork of biological engineering, and we're going to explore every nook and cranny, from the foundation right up to the penthouse. So, let's get right into it.
So, let's start with a mind-boggling question. How on earth does this one single muscle pump 2,000 gallons of blood every single day? I mean, that's enough to fill a small swimming pool. How is that even possible? Well, as you're about to see, the genius is all in the design.
So here's our blueprint for the tour. First, we'll get our bearings with its location and the protective sac it lives in. Then we'll step inside for a tour of the 4 main chambers. After that, we'll map out the plumbing, the blood flow, and its one-way doors. And finally, we'll check out the power, fuel, and control systems that keep the whole thing running.
Okay, first things first. Location, location, location. The heart sits right in the chest, in a little compartment called the middle mediastinum. But it's not perfectly straight. It's actually tilted a bit forward and to the left. And that's why you can literally feel its tip, the apex bead, tapping away right against your chest wall, in between your 5th and 6th ribs.
Now, any important building needs a top-notch security system, right? Well, for the heart, that's the pericardium. It's this incredibly tough, multi-layered sac that acts like a protective wall. It shields the heart, stops it from overfilling with blood, and anchors it right in the middle of your chest. And the way these layers are set up is just brilliant. You've got this tough, fibrous outer layer for strength. Then inside, you have 2 super smooth inner layers with a tiny bit of fluid between them. This basically creates a near-frictionless environment for the heart to beat in and day out. Oh, and here's a really cool clinical tidbit. The nerve supply is from the phrenic nerve, which is why heart inflammation, or pericarditis, can actually cause pain up in your shoulder.
Tucked away inside this pericardium are these hidden passages, or sinuses. The first one is the transverse sinus. Think of it like a secret tunnel that runs behind the 2 huge outgoing arteries, the aorta and pulmonary trunk, separating them from the big incoming veins. There's also the oblique sinus, which is more like a cul-de-sac behind the heart, formed where the pericardium folds around those big veins.
And this isn't just some random anatomical detail, it's absolutely critical for surgery. During open heart surgery, that transverse sinus is the perfect natural passageway for a surgeon to slip a clamp through. It lets them safely stop blood flow when they need to. It's like a built-in surgical access port designed right into the architecture from the start.
All right, we've seen the outside. Let's head inside the building now and take a tour of the 4 main rooms, the chambers, where all the magic really happens.
Our first stop is the right atrium. You can think of this as the grand lobby, where all the deoxygenated blood from the body arrives. Inside, you can see a few key features. There's this ridge called the crista terminalis, and that's important because the heart's main pacemaker is located right at the top of it. And see that little thumbprint-like depression? That's the Fossa Ovalis. It's a fascinating leftover from before we were born, when it was an open door that let blood bypass the lungs.
Okay, next room, the right ventricle. Now, when you look inside, you might see this muscular strap stretching across the chamber, the moderator band. At first glance, it almost looks random, kind of like a misplaced support beam. But trust me, its function is anything but random.
So what does it do? It's an electrical shortcut. It's basically a dedicated wire in the building's electrical system that carries the signal to contract directly to the far wall of the ventricle. This ensures that the whole room contracts at the exact same time, giving you one single, powerful, efficient push.
Now let's cross over to the absolute powerhouse of the heart, the left ventricle. Just look at the walls. This chamber's muscular wall is a whopping 3 times thicker than the right ventricle's, and it has to be. It's got the massive job of pumping oxygenated blood to your entire body. But all that power comes with a risk. If a heart attack damages the little muscles inside that control the valve, they can rupture, leading to a total, catastrophic valve failure.
Okay, so we've seen the rooms. Now let's map out the building's plumbing. How does blood actually get around in here? And what stops it from going the wrong way? Well, it's all about 2 circuits and 4 amazing one-way doors.
So let's follow a drop of blood. It comes back from the body all tired and out of oxygen, through the big veins into the right atrium. From there, it passes through the tricuspid valve into the right ventricle, which then pumps it through the pulmonary valve and sends it off to the lungs for a quick pit stop to refuel on oxygen.
Now, loaded up with fresh oxygen, our blood cell zips back from the lungs and into the left atrium.
It flows through the mitral valve into the super powerful left ventricle, which then launches it through the aortic valve into the aorta, sending it on its mission to deliver oxygen to every other part of the body. You've got two circuits working in perfect harmony, powered by one incredible pump.
And understanding these two separate circuits is the key to understanding heart failure. It's really simple. If the right side of the pump fails, the plumbing backs up into the body, which is why you see things like swollen legs. But if the powerful left side fails, the plumbing backs up into the lungs, causing fluid buildup and making it hard to breathe. The symptoms tell you exactly which side of the pump is in trouble.
And these are the four crucial one-way doors we were talking about, the valves. They're what keep the blood flowing in the right direction. It's kind of like a mechanic listening to an engine. A doctor knows exactly where to put a stethoscope on your chest to listen to each valve individually. Just from the sound, they can tell if a door isn't shutting quite right.
So for our final stop, let's head down to the utility rooms. A building this complex, working 24/7, needs its own dedicated power plant, its own electrical grid, and its own fuel lines to keep running.
The heart's fuel, its blood supply, comes from the coronary arteries. But here's a fascinating thing. The plumbing isn't the same in everyone. In about 85% of us, a key artery at the back of the heart is supplied by the right coronary artery, so we call that right dominant. For surgeons and cardiologists, knowing a patient's specific plumbing layout is absolutely crucial before they go in.
And here it is, the building's electrical grid. The spark starts at the SA node, the heart's natural pacemaker. It travels to the AV node, which cleverly adds a tiny delay so the ventricles have time to fill with blood. Then the signal shoots down the main cables, splits into the branches, and remember that shortcut, the moderator band, and then spreads through the Purkinje fibers, telling the ventricles to contract in perfect synchrony.
What's so amazing is that this whole system just runs itself. The SA node will fire automatically, setting a resting pace of 60 to 100 beats per minute. Every minute of every day for your whole life, without you ever having to think about it once. It's just incredible.
Which brings us to a final crucial question. We've just toured this incredible piece of living architecture, where every single part, every wire, every pipe, has a purpose. So what happens when this perfectly synchronized system starts to fail? A blocked fuel line or a short in the electrical circuit can have absolutely devastating consequences for the entire building.
We've really only just scratched the surface of this amazing structure today. If you want to really master the anatomy of the heart, you should definitely head over to our website. We've put together some high-yield notes, a great mind map for quick revision, and even a quiz so you can test yourself. The link for all of that is right there in the description below. Thanks so much for joining me on the tour.